So this is the prosection of head and neck, and we're going to look at the major features of it. First, we have this muscle. This is known as sternocleidomastoid. Then we have this carotid sheath at the side of the neck and the contents of carotid sheath. So most laterally we have this internal jugular vein. In the mid we have this vagus nerve, and most medially we have this common carotid artery, which will then bifurcate into internal and external carotid artery. Then we have these muscles. This most prominent muscle is the sternohyoid muscle, which is coming from sternum all the way to the hyoid bone. Behind or below this we have this sternothyroid muscle, which is coming from the sternum and all the way towards the and it attaches onto the thyroid cartilage. Then we have this submandibular gland here. On this ramus of mandible is the angle of mandible. We can see this masseter muscle. Here we have mentalis muscle, and this is the piece of parotid gland, since it has been removed from here, so we cannot see the whole thing, but this is a little piece of parotid gland, and this is actually the region where parotid gland would be located in the real specimen. Below this, in this specimen, we cannot see it properly, but behind this we can see this. Here we have parotid duct, but in this specimen it is not present, so we cannot see that because we don't have the parotid gland here. But here we also have the parotid duct. Then we have this muscle. This muscle is known as zygomaticus major, and here, if there is a point here, this is nasalis muscle, and this is all. And here we have these are the facial vessels. This is the one which is laterally, this is facial artery, and the one which is present medially, this is facial vein. That is all.